It's often the permanent losses children face, such as death or traumatic loss, that challenge our practices. What are we to do? What are we to say? What do children really understand about death? Although we're not experts, there are things to think about in supporting children's grief and understanding of death.
We know from research that within the first 24 hours of life, a child knows their mother's voice from all other voices. Any human that has the capacity to love, and a child has that at 24 hours. I was saying the difference between the loss of an adult. When you and I sustain a loss, we can develop a feeling and hold on to a feeling about anything for as long as we live. Young children don't have that capacity. It's why they're so buoyant and so delightful to be with, is because they can be sad one minute and happy and laughing the next. And we know about early childhood that their attention span is short. Their feeling span is also short. They could never have a sustained conversation like you and I are having, just because that their feeling span is so short. They may be playing in the sandbox at the water table and say, "My dad died." And that's the end of it. They don't expand on it. And that's why when you hear those words or you see behavior that's indicating that they're hurting, why it's important to bring up the issue and say, "I know your dad died." And that is such a sad time for you and your family. And I'm feeling sad because your dad died. And I think in that connection, that's where the child begins to heal.
In the book Explaining Death to Children, Dr. Earl Groman suggests helping children understand death by explaining it in terms of the absence of a familiar function or functions. For example, when flowers die, they don't bloom anymore. When people are dead, they no longer breathe, eat, talk, think, or feel anymore.
When you talk to young children or they ask a question, I always say, just answer it simply, briefly, and without detail. They don't have a sense of time, so they don't understand the permanence of loss. When we say daddy's gone, you shouldn't use those kind of words, or that you lost your dad. Because young children are so literal, he might start looking for dad if you use the word lost. It's best to use the words death, dying, and dead, because they'll learn what those words mean.
Children need to be involved in an honest, reassured, developmentally appropriate way. As we carefully listen and observe, children will teach us about their grief and what they understand about death, which is very different from adults.
Honesty is always important because children will know that something is happening. They will know that you are upset. They will know that families are upset. And so it would be a combination of honesty and reassurance.
Because of developmental abilities and cognitive limitations, young children do not fully understand death. To support a healthy grief process, or what some call good grief, children will need to grow in their understanding, grieving, and commemoration of the death.
Of course, we've been through a lot of different pets, and I've tried to do my science inquiry, and let's watch this dead fish. This fish is dead. What should we do? What will happen next? And the fish is dead, and we're watching it for the longest time. And the children will really persist in believing that we can bring this fish back to life again. Maybe if we just give them a little more food. Let's put them in some fresh water and see. And they really, really do persist in believing that death is reversible in the face of all evidence. And if you've ever watched, children often like to pretend that they're dead. They'll play dead. They'll fall on the ground and they'll say, "Oh my goodness, what has happened?" But they will always come back to life again. Sometimes you will give them the information. I don't think this bird is going to come back to life again. But I will always listen to their ideas as well. What do you think will happen? We have different ideas, and you can have your ideas and I can have my idea, and I feel comfortable with that.
Rituals and commemorations may help children work through grief, but should be appropriate and by choice. The National Association of School Psychologists reminds us that talking to children about death must be geared to their developmental level, respectful of their cultural norms, and sensitive to their capacity to understand the situation.
So there are many different traditions for everyone to participate in remembering. If you're near Mexico, there are Day of the Dead celebrations. If you're here, there are Memorial Day celebrations. And so that's one place where children become part of the traditions of our culture of understanding death or of remembering people who have died. Always you respect the diversity of families' expressions about things, and always the explanation to children is some families believe one thing and some families believe another. So, and you will usually believe what your family believes. So some children will talk about he's in heaven now, and somebody might dispute that, and you will say, well, this family believes that they're in heaven, and different families have different ideas about these things, and you'll usually believe what your family believes. As in always, you take your cues from what the children say and what the children are interested in, and you answer questions honestly, but you don't take it beyond whatever their expression or interest is, or they're not far beyond that. So if they talk about someone who died, then you would quite honestly talk about someone dying. You tend to mirror their language about it. Children can grieve when the adults around them can provide an environment that's safe enough for them to feel and show those feelings. If the adults around them are uncomfortable talking about death or showing their feelings around death, then children will say, this doesn't look like a very good thing to talk about right now, and they'll tuck it away until they find someone with whom it seems safe to share those feelings of grief. And so there is often a feeling among adults, oh, look, they've forgotten it already, when actually what's happened is it doesn't quite feel safe enough to share.
It's not about fixing the grief or even taking away the pain, but rather it's about being present and mindful of the grief that is uniquely individual to the child.
Visit Better Kid Care. www.betterkidcare.psu.edu. We care because you care.